Welcome, everyone. We're back and ready to go. So with that, I'm going to hand it over to the Director of our Learning Communities Resource Center, Tiffany Marley, to get us started today. Tiffany?
Yes, hello, everyone. Thank you very much, Cashin, and I'd like to welcome everybody to today's national webinar presentation on decreasing family homelessness. My colleague, Cashin, you have already introduced herself. I'm also joined today with my colleague, Zandy McKinley, who is the Program Associate for the Learning Communities Resource Center, and I, Tiffany Marley, am the Project Director. And let me just start by saying this, and this is an important thing. That is, it's been 52 years since the war on poverty was launched by Lyndon B. Johnson, and from the very beginning of that time, the Community Action Network has been on the front line against the war, and for all intents and purposes remains on the front lines of this very complex fight. With that in mind, the learning community, next slide, aims to equip the CFBG network with resources and training so we can engage in this anti-poverty work very effectively. Next slide, because what we know is that anti-poverty work, it rests at the heart of who we are as a network, but it also rests at the heart of what we do. So one of the most complex conditions of poverty is this whole notion of family homelessness. And as a network, I would venture to say that we are positioned well to meet the unique needs of families who are experiencing homelessness. Next slide. And it is Jeannie Chapin who has said that as a network, we must be focused on the right issues to address poverty today. We have to be in tune with these issues and reflect on and create strategies that have impact. And so through the work of this decreasing family homelessness, learning community group, and really in partnership with the National Alliance to End Homelessness, we as a network will be thinking in a meaningful way about what it means to move homeless families from crisis to thriving. And we will offer a series of national webinar presentations for the entire network. And the thing that I'll mention about this is agencies were invited, individuals were invited to sign up to be members and followers of this group, but this group is an open group. So anybody at any time can sign up to participate in any portion of this series. And so as I mentioned previously, we are joined by the National Alliance to End Homelessness, and they, along with other homelessness advocates, have engaged in some significant milestones over the years. And our presenters today are going to talk about that, but I thought it was important to just highlight these things, and that is over the past several years, there have been changes so that now we have rapid rehousing standards, which will be talked about a little bit today. Now we have a federal framework in place to end youth homelessness, which is a huge, big deal. Along with having the framework, we also have money on the table provided by Congress to support practice and knowledge development related to ending homelessness. The other thing to note is that there's a National Housing Trust Fund that was created back in 2008, which helps to infuse resources towards providing services for families who are dealing with homelessness. And so there are various dimensions of homelessness and various domains that sort of get brushed up against. And as we engage in our conversations in the future, I think things that we can listen for in terms of some of those domains or overlapping areas might be reentry, justice, racial equity, toxic stress, trauma-informed approaches. And so it's going to be a very interesting ride for us as we think about this whole notion of decreasing family homelessness and trying to derive some innovative, promising practices to fight that poverty more effectively as we go as a network. And so if we go to the next slide, it's the promise of community action. I'm sorry. We can go back to the promise of community action because it's safe to say that as we think about this important work that we've been called to help people and change lives and come up with effective strategies to fight poverty. The end game is found in the promise of community action itself, which says this: community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. So next slide. And so in today's presentation, we will receive an overview related to decreasing family homelessness. Our presenters will talk a little about improving family homelessness systems, talk a little bit about what's happening that is impacting policy, and then here is another important thing. They will talk about the role of community action agencies in this work, and then we will conclude with some time of question and answer. And Kasha has already mentioned that you all can use the question and answer box to put in your questions. You do not have to wait until the end of today's presentation to share those questions. So as they come to you, go ahead and share those with us, and then we will prioritize those for our discussion that will happen at the conclusion of today's presentation. Next slide, Cashin. So let's take a moment to meet our presenters. So as I mentioned, in order to live into this thrust on decreasing family homelessness, the partnership has entered into a wonderful partnership or alliance, whichever word you would like to choose, with the National Alliance to End Homelessness. They are otherwise known as the Alliance as well. And we are joined by two colleagues, Sharon McDonald, who is the Director for Family and Youth. And Sharon has worked with the Decreasing Family Homelessness Learning Community Group in the past, and we're excited that she is really driving the strategic direction of our work within the context of the learning community during this project period. And the interesting thing about Sharon is that she is no stranger. I really regard her as an expert as it relates to this field. She's worked on the ground, on the front lines of homelessness, and brings that frontline perspective as well as now the broader macro policy perspective. Next slide. And she's joined today by her colleague Cynthia Nagendra, and Cynthia is the director for the Alliance's Center for Capacity Building. And there again, Cynthia is giving particular emphasis to systems-wide strategies to prevent and end homelessness, and works with the capacity building team for the Alliance across various areas. And one that I will point out that is of interest is that it spans everywhere from veterans homelessness all the way to those important processes that go into facilitating an effective continuum of care in our local community. And so these are our presenters. And as we go to the next slide, it's my pleasure to hand the baton over to them. Don't forget to ask those questions, and we thank you for dedicating your time to learn about and to talk about this important issue. Sharon and Cynthia.
Okay, thank you very much, Tiffany. And before we move to the next slide, let me just also say that we at the Alliance are very excited about the opportunity to work with a community action partnership and trying to identify and elevate some of the promising work that's already happening in communities. We are well aware that community action agencies are on the front line doing lots of different things for people who are on the cusp of or experiencing homelessness, and I think there's probably lots of good stuff that's going on that we're not aware of, but my hope is that we'll also be able to kind of move practice along by learning from one another throughout this process. So we definitely want this to be collaborative, and we want to hear about what people identify as their particular learning needs, and we do have a lot of expertise that Cynthia brings with her team based on everything that they've learned on the ground and working with programs to improve their overall effectiveness. And so we're really looking forward to this, and this is the kickoff. So this may be some of the material that I am going to go over, maybe old hat for some of you, and for others it's going to be newer information, but we wanted to provide this for this kickoff webinar, really an overview about big picture, what it is that we know about family homelessness and how is our response changing, and then in subsequent webinars we'll really dive in deep into the areas that are of particular interest. So we're just going to give that 3,000 view overview. So if we can go to the next slide, we'll start with some of the basics. So there's two different ways that we count people who are experiencing homelessness. In the HUD world, we are looking at the number of people who are homeless on any given day, so that's a point-in-time count, and that includes families living in shelter, transitional housing, or in outdoor locations. So that's usually done in January, and at the last point-in-time count that we have data from, we've identified 65,000 families with children on a single night. And about 1 in 10 of those families were identified in a place not intended for human habitation. That means that they were found living in cars and campgrounds and actually outdoors all night. So unsheltered homelessness is occurring for children as well. We also have an annual prevalence of homelessness, and that is the number of families who were served over the course of a year. So over the course of a year, the HUD-funded homeless assistance programs and other homeless assistance programs, this doesn't typically include, well, I'm not sure if it includes all domestic violence programs or some, but we identify 160,000 households with experiencing homelessness or using homeless services over the course of a year. Another number that you hear a lot is the number of children experiencing homelessness that meet the definition, the Department of Education definition of homelessness, and that is a much more expansive definition, and it includes families living in doubled-up situations and in motels and not necessarily interacting with the homeless service programs. So over the course of the school year, counting school-aged children, $1.4 million children are identified as living in that experience of homelessness. Next slide. So at its essence, homelessness is really about the disconnect between family incomes and the cost of housing. And we know that when families have access to affordable housing, few families become homeless, and few families remain homeless if they have access to affordable housing. So we've seen multiple studies have found that families who exit homelessness with a subsidy will not return, and even those who do return, it's usually related to a sometimes solvable issue with their subsidy. Their rental unit no longer passed inspection. The landlord decided not to accept the Section 8 voucher any longer, but there's an issue. So it's, for most families, it's about affordability. Similarly, when we look at families who were randomly assigned to have a housing subsidy, families living on welfare, very poor families, those very, very few families that receive a housing subsidy became homeless. So it virtually eliminated homelessness. Next slide. Unfortunately, what we see, though, is that the gap between families' incomes and the housing costs are very disparate. There's a big gap. So for families living with an area median income of 30% or less, there's only 31 affordable and available units per 100 renter households. For poorer families, there's only 17 affordable and available rental units per 100 households. So what you see is families who fall out of homelessness, who fall out of housing, families who are doubling up in order to meet their housing needs. So sometimes you will see some overcrowding, and then the other strategy that you see is that very poor families are paying extraordinary amounts of their income towards rent. So for low-income renters, those with incomes of 30% or less, they're paying 75% of their incomes, 75% of those with extreme low incomes are paying 50% or more of their income on rent and utilities, and almost all families earning 15% or less of the area median income pay more than 50% of their income for rent and utilities. Next slide. And according to the Center on Budget and Policy Priorities, we only have about 1 in 4 poor families will receive federal rent assistance. And the availability of housing subsidies was contracted due to sequestration. So in December of 2015, 45,000 fewer families were receiving federal housing assistance than in December 2012. So we're still climbing out of the impact of the sequestration. Next slide. So in general, families who become homeless, what studies have told us over and over again is that families have characteristics that mirror those of other low-income housed families, including families receiving TANF assistance. They have similar challenges, including similar employment challenges, mental health challenges, experience with domestic violence, though for families experiencing homelessness, it may be more recent, but in general, families who become homeless do so primarily because of the gap between their income and the cost of housing. Next slide. So what do we know about families who do become homeless? By and large, they're single parents. Parents are often very young. Many are under the age of 25. In some cities, it may even approach 50% are under the age of 25. African American families are heavily overrepresented, 3 times the rate in the general population and 2 times the rate of the population living in poverty. Half of the children who are in shelter over the course of a year or transitional housing are age 5 or under. And what research has indicated to us is that the risk of homelessness is higher the younger the child. So pregnancy and childbirth actually seems to be close to a precipitating event. So most of the families who become homeless do so from a doubled-up situation, and the birth of a child, an infant in the house, might just lead to enough tension that the young family is ejected from the home and seeks shelter. Families are very poor and have thin social networks that they can rely on, and researchers wonder whether they've just depleted them on their way to the homeless service system, or they were thin to start off with. Research looking at how children fare, obviously homelessness is bad for kids, we know that, but researchers have largely concluded that the impact of poverty on the lives of children is so profound that sometimes it's difficult to discern the additional impacts of homelessness on top of the profound impact of poverty. But they've largely stated that children who are homeless are likely at the far end of a continuum of risk. So poor children are worse off on some indicators or most indicators than children in families with greater means, and children who are homeless, particularly children who are have high levels of mobility, you might imagine, are going to be at even further detriment. And we have found that about 20% of parents in families experiencing homelessness have a disability. Next slide. So how families interact with the homeless service system. You know, this is a bit of a challenge to what we believe or what we thought we knew. Few families enter shelter immediately following an eviction or after being a leaseholder, immediately after having their own unit. So historically, how we've done homeless assistance or homeless prevention assistance, it's historically been you know, providing somebody who has their own apartment, has an eviction notice, is behind their rent. We're using some of our homelessness prevention resources there historically, but that's not where the risk of homelessness is greatest. Few of those families actually enter shelter. Most families are entering from doubled up situations and are ineligible often for those traditional homeless service systems. Most families who become homeless, and this is the most recent data, rely only on emergency shelter. About a quarter of all families who become homeless will enter a transitional housing program, which is designed for lengthy stays in residential programs to receive services. But most that enter stay only a brief period of time, on average 175 days. Next slide. So, probably this is the most important research that we had, and this data is about 10 years old, but I just saw data today from another county, and it lines up quite nicely. This is research by Dennis Culhane that looked at data on family homelessness from 4 jurisdictions, so from the state of Massachusetts, from New York City, from Philadelphia, and Columbus, Ohio. And using those large data set systems, what he identified was that most families who become homeless are homeless for a short period of time. They enter shelter and exit and don't become homeless again. That's the typical or most common experience of homelessness. We have a subset of families who end up having very lengthy homeless episodes, typically stays in transitional housing for a period of a year or more. They don't, on any criteria, look that much different from families who have shorter-term episodes of homelessness. And actually, there may be some there's often some screening associated with entry into transitional housing programs. So you got to prove that you meet certain criteria for getting into those programs, and you got to meet certain obligations for staying in those programs. So they might end up siphoning off or preventing some more of the most vulnerable families from getting in. So this is not necessarily a needier subpopulation. They may even be slightly more advantaged than some of the other families experiencing homelessness because of that screening criteria. Then there is a small group of families, and these are the families that actually seem to have the greatest indicators of having severe service needs. So this is a subset of families, and they're not a large segment of the homeless service population, but that have a parent with a history of inpatient hospitalizations for a mental health or substance use disability. This is the population. These are the families that have the highest risk of having a child removed from the home and placed into foster care. Next slide. So the information about, Dennis's information about who these families are raised important questions about how we were using homeless services resources, and I think was fundamental to some of the shifts that ended up happening. What he found was that most families remain homeless for a short period of time, and how they were often using it was a place to go while they were trying to get their resources together in order to save up and get out of homelessness. So they were staying in shelter while they were looking for work, while they were saving up for a security deposit, while they were contacting a family member that they could stay with, while trying to find housing on their own. It was a crisis intervention period of time. It was a respite while they tried to get all those other pieces together. The families, I'm going to go to the bottom one, families with the multiple homeless episodes, we weren't really helping them all that much at all. They were coming into shelter, they were staying for short periods of time, and they were leaving, and they had lots of service needs, as we could see. They also you know, another study that followed this subset of families found that this subset of families were were in a lot of chaos. You know, when they re-entered shelter, they often re-entered shelter missing a family member. So they were or with new family members. So they were never really achieving housing stability between their homeless episodes. They were leaving a child off with an aunt, or they were, you know, had another cousin come and stay with them. So there was just a lot of chaos, but the homeless service system wasn't really doing what it needed to do to provide any kind of stability. It, again, was just a respite on their bouncing around between unstable situations. Where we were spending the bulk of our resources, however, were lengthy stays in homeless service programs and largely in transitional housing programs. And I think what was important here was that the stays were really very expensive. So the bulk of the resources, or a good portion of the resources, were being spent with families who didn't necessarily have more acute need for those supports. And the cost of a year-long shelter stay approached, and this is older data in some of those communities, approached nearly $50,000 a year. That would be the more expensive places like New York City and Massachusetts. But there was definitely opportunity costs there. So about 20 to 25% of families at this point were getting an intervention that approached $50,000 a year, while 75% of families received very little from the homeless service system except emergency shelter. And so there was some question that maybe transitional housing programs are very important for some families, that we should be thoughtful about when and where that is. And for $50,000, you could provide one family, instead of a year of transitional housing, one family 5 years of rent subsidies, or you could provide 5 families 1 year rent subsidies, or 10 families 6 months rent subsidies. So could we be using these resources more effectively to serve more people, remembering that, you know, today, and it was probably worse then, 1 in 10 families are actually sleeping outdoors on any given night. Next slide. So this is where we are, I think, today. For families who have short-term experiences and episodes of homelessness and short-term transitional housing stays, instead of having them stay in shelter while they're trying to get the resources together to get out of shelter, what can we do to help minimize that stay? And really that's about rapid rehousing, which I'll come to next. Long stays, we really should be taking very careful look at long episodes of homelessness and transitional housing, long and costly stays, and minimizing those, also providing the bulk of those families with assistance to get back into housing. And we should preserve the richest interventions and provide a much more intensive response to those families who are bouncing around between places, and really help to stabilize and put them on a platform for greater stability. Next slide. So just very quickly, what rapid rehousing is essentially the 3 pieces that families need to get out of homelessness, or lots of people need to get out of homelessness. I think that by and large, what people have historically done is, as I said, is they're trying to save up enough money to rent housing on their own, to, while they're in shelter, to look for a landlord who's willing to overlook their eviction history and to get stable in a new place. And that can take months and months without any help. The idea of rapid rehousing is you're providing a tailored intervention to families or individuals that helps them achieve their own goals. Help them find a landlord that's willing to rent to them and a housing that meets their needs. Instead of having them save up the money while they're homeless, often at a cost far higher than providing rent assistance, provide them with a security deposit first month, second month, if needed more, assistance to move back into housing, and provide the follow-up case management and services to make sure that they stay housed. So next slide. So some of the benefits of communities, I'm just going to talk a little bit about rapid rehousing here for a second. Some of the benefits that communities have found that have expanded their use of rapid rehousing is that few households assisted with rapid rehousing have a subsequent homeless episode. Families have reduced length of stays, and that's important too, and you have communities that are declining shelter to households on a fairly regular basis. So if you're cutting down the amount of time that families stay in shelter, that means that you are reducing that you're able to accommodate more families over the course of a year. And it's a lower cost relative to other approaches, and that means that more households can be served. Next slide. Very quickly, there's been some big research. So HUD and APT Associates did this big national demonstration that compared families' outcomes, whether they got a housing subsidy, whether they got a rapid rehousing, or whether they got transitional housing. And actually, I need to correct myself. It wasn't based on whether they got it. It was based on whether they got preferred access to those interventions. And what we found, or what they found, was that largely families who had preferred access and received the housing subsidy escaped homelessness. I don't think we were surprised by that, but they also had some profound lasting benefits for families across multiple dimensions. So families that received the housing subsidy were also far less likely to experience domestic violence because they had the resources to leave a partner that was abusive. They were protected from food insecurity because they're not paying a disproportionate amount of their income for rent. They are less likely to double up because they don't need to double up in order to meet the rental costs. Families' stress was down. So there was a number of profound impacts. The best outcomes were for families who managed to get a housing subsidy. Again, only 1 in 4 families nationally are able to access a housing subsidy that needs it. Now, looking at families who were referred to rapid rehousing versus whatever was normally available in the homeless service system, we saw some improvements. Families' incomes were slightly higher, about $1,000 over the annual income. Their food security was higher, and children's school attendance improved. There was also a decrease in their initial stay in shelter. But 20 months after entering the shelter system, they didn't necessarily look any different than families who were referred to other interventions as far as their risk of doubling up or experiencing a subsequent homeless episode. Again, few families returned to homelessness, but it was about at the same rate regardless of the intervention. Now, looking at families that actually got rapid rehousing, so just the families that got preferred access to rapid rehousing didn't necessarily take up rapid rehousing. So looking at the families who actually did get rapid rehousing versus those families who said no thank you, they were far less likely to have a shelter stay after exiting homelessness. So 23% of families who exited with rapid rehousing did return to shelter at some point versus 33% that did not. They were also more likely to be in their own house or apartment at follow-up as opposed to doubled up. And their time in emergency shelter decreased significantly. So families who received rapid rehousing spent about 2 months in emergency shelter versus families that didn't take that intervention who spent about 5 months. And the cost of the intervention, this is quite important, is about $6,600 per household. So that's a fraction of the cost of providing transitional housing, which means that you can serve more people. Next slide. And this is just a study. I think a lot of community action agencies across the country have received SSVF funds. So these were dedicated resources for homelessness prevention and rapid rehousing assistance to veterans and veterans' families. So I believe it's over 100,000 veteran households have been served with rapid rehousing to date. And what we see is very few returns to homelessness. And that is also true for families and for single adults with very little income. So people with very limited means are able to retain that housing. Next slide. I think actually the most important thing about rapid rehousing has been the change to the homeless service system overall. So I've just picked out 3. We have lots more if you want to learn about some more. But Salt Lake City, for example, reduced their average length of shelter stay in half during the recession. That allowed communities to shelter higher numbers of families that were turning to them for services during a very bad economic time without expanding shelter capacity. So they were able to avoid having to turn any family away. San Francisco is a community that is not a right to shelter. That means that there's a wait list. Families call up and ask for shelter and are told it might be a few months. They are able to correlate that an increase in rapid rehousing capacity results in a decrease in shelter wait lists. When families are exiting at a regular pace, then people in crisis are able to enter shelter. Spokane County, or Spokane City, looked at their family homeless service system, and they moved some of their transitional housing programs to provide to shorter length of stays, and then they downsized some of their transitional housing programs to reallocate the money towards rapid rehousing. And through making those shifts, they were able to essentially double the number of families they served over the course of a year with the same amount of funding, and they no longer see wait lists for shelter or families living outdoors. So I think that's part of the benefits of changing the response. Next slide. So nationally, we see a change in how homeless services are being designed and what's being encouraged. There is a heavier focus on homelessness diversion versus homelessness prevention. I touched briefly on the reason for that, but essentially what we found is that it's very few families who become evicted enter homeless services, and it's very difficult to predict families who are at risk of homelessness that will actually enter homelessness. By and large, families who become homeless look just like families that don't become homeless, and so it's you might spend, and I'm being very general here, you might need to spend $10 on homelessness prevention dollars to spend $1 in actually preventing a homeless episode. Shelter diversion efforts are really moving that prevention intervention much closer to the shelter door. So when families are calling for shelter or in crisis and their entrance into homelessness is imminent, like they're looking for a place tomorrow, somebody's asked them to leave, that's where people are now being encouraged to invest their homeless assistance resources to see if they can prevent that person from having to enter shelter. What can they do to help them stay where they are right now in order to stabilize them there and then work from that platform as opposed to having the family have to enter shelter. There's an increasing reliance on rapid rehousing and an encouragement of policies to do more of that. there is a downsizing and reallocating of transitional housing resources, so communities are being encouraged to really be very, very thoughtful about when and where and how much transitional housing resources are being retained. And permanent supportive housing, which and other permanent housing resources. So to the extent that you're able to get your hands on a permanent rent subsidy for homeless families, or permanent supportive housing, which is essentially rental assistance and case management supports, typically reserved for very high need populations. Really, where are those most critical? This is sort of a very scarce resource, so where is it most needed? And I would suggest it would probably be those families with the multiple homeless episodes and very unstable lives that we could use that richer intervention to provide additional support there. Next slide. So this is the U.S. Interagency Council on Homelessness, the Family Crisis System Framework, and it's just a visualization of what I talked through. Increasingly, we're seeing a coordinated assessment, so people with crisis housing needs are being assessed and targeted and directed to the right intervention. You will see that the primary response after shelter is rapid rehousing, targeted transitional housing, and really a rapid relink to community-based permanent housing. And rapid rehousing is usually short-term rental assistance, so it's a big focus on helping people find housing that they're going to be able to maintain over the long term. So I'm going to leave this slide here for a second and then turn it over to Cynthia to kind of, if she wants to add any thoughts here before going on to some of her slides.
Thank you, Sharon, and thank you for to the Community Action Partnership for inviting us to speak today. I think Sharon, I think that you covered everything in this map really well, and I'll connect some of it in my next slide. So if we could go to the next slide, that would be great. So I'm going to talk a little bit about some of HUD's national policy goals and priorities, the COC NOFA application process, and how these things may impact CAP agencies. We know many CAP agencies participate in their continuums of care, receive COC funds directly or other homeless assistance dollars, and we thought that it would be helpful to provide this orientation to HUD COC funds and priorities and kind of talk about where CAP agencies might fit in. So in 2009, the McKinney-Vento Homeless Assistance Act, which is where continuum of care funds come through, was amended by the Homeless Emergency Assistance and Rapid Transition to Housing Act, which you probably know as the HEARTH Act. Among other changes, this amended act consolidated 3 separate HUD programs, the Supportive Housing Program, the Shelter Plus Care Program, and Section 8 Mod Rehab SRO program into one single grant program, and that's now known as a Continuum of Care or COC program. And under HEARTH, COCs are now charged with designing a local system to assist people experiencing homelessness and providing the services necessary to help them access housing and attain long-term stability in all the ways that Sharon had discussed. So in other words, the HEARTH Act really shifts communities from managing homelessness in separate and siloed programs, that are all working to do good things in a community, but not necessarily in a coordinated fashion, and really makes a shift to solving and ending homelessness in a more systemic and coordinated way, and includes not just COC-funded grantees, but really stakeholders across an entire community, and this is why CAP agencies can play such an important role. COCs should really now be promoting community-wide planning and strategic resources, strategic use of resources to address homelessness, and really be working together to look at the system as a whole rather than at the program level. So communities should be enhancing coordination and integration with mainstream resources, other programs targeted to people experiencing homelessness, and improving data collection and performance measurement across the whole system. So Now HUD asks COCs to focus on viewing the local homeless response as a coordinated system of homeless assistance options, as opposed, as I said before, to homeless just assistance programs and funding sources that are kind of operating independently in a community, sometimes duplicating and sometimes not necessarily seeing the gaps in a community. So to really facilitate this, HUD is requiring communities to measure their performance as a coordinated system and analyze performance not just by projects and project types, but to really look across how is our system doing as a whole in reducing, preventing, and ending homelessness. And HEARTS establishes selection criteria, which you see here on this slide. They use these to award COC funding and requires continuums of care to report to HUD these performance measures and really include, as I said before, not just COC funded programs, but really all the communities that are working on homelessness. All the programs that are working on homelessness in a community. And so the HEARTS outcome measures you see here are to reduce overall homelessness, to reduce the number of people who are becoming homeless, so the new folks coming into homelessness that are new, we want to reduce that number. Reduce the average length of homelessness that a family experiences. We want to reduce returns to homelessness and make sure that people stay housed once they exit the homeless system. Increase jobs and income, and that can be through benefits and other types of assistance. Also measuring other types of accomplishments that communities do in reducing homelessness and really making sure that communities are thoroughly reaching everybody in the homeless population, that everybody is able to access services, even those who may have not traditionally accessed services before or have not been engaged in the right ways. We want to make sure that everyone is really being reached by community services and housing. And the intent of these performance measures is to require and really encourage COCs to, and also in coordination with ESG program recipients and other homeless assistance stakeholders like CAP agencies, to regularly measure their progress in meeting the needs of people experiencing homelessness and also to report it. But these are really the ways that a community can know if it is truly making an impact with its programs and actually moving towards ending homelessness. I think many programs are used to sort of measuring outputs, sort of how many people we've served, how many meals we've served, how many dollars we've given out. And this is looking at performance from a more systemic level. Are we really reducing the number of people who are becoming homeless? And if we're not doing that in a community, what do we need to change to make progress toward those goals? Next slide, please. So if you're a CAP agency already receiving HUD COC funds, you're probably pretty familiar with the COC NOFA process. However, if you want to apply for funds for the first time or try to get a better understanding of your continuum of care or thinking of applying for funds, this will be of particular interest to you because the HUD really uses the continuum of care NOFA process, the notice of funding, to drive change on the ground locally. So really trying to help communities align their priorities with federal priorities. And every year, HUD holds a national competition in which COCs must compete to receive their renewal funds, the funds that they have gotten in the past, and sometimes to apply for new funds that are available. So all projects receiving program funds in a community have to compete locally, meaning sort of the programs that are in one community compete with each other and then are now reviewed and ranked locally. And then this continuum of care sends a consolidated application to HUD and then competes with all COCs in the country. So the 2015 NOFA was very different than in years past, and that's important because HUD's created an application process with a really strong emphasis on evaluating project and system performance, as I was saying in the last slide, and to reallocate funds to effective programs that actually reduce homelessness, and really uses the NOFA to drive these changes, to prioritize certain goals and interventions. And as Sharon discussed, we know a lot of solutions that do work. We know what the cost-effective solutions are. We know ways to reduce family homelessness, and we also have a better idea of how to right-size these interventions. And the map that Sharon was talking about on sort of the different interventions, that kind of gives us a sense of what types of interventions we need to have, the size of them we need to have. We might have each of them, but we might not have enough, or we might have too much of one. And so using these kinds of priorities and looking at your data to really evaluate, do we have the right size of interventions to really make a good impact in reducing family homelessness. So here are some of the key priorities from last year's NOFA. We can expect that they will be similar this year because many of the goals are articulated in Opening Doors, which is the federal strategic plan to end homelessness. And so I'm just going to talk about these really quickly. The first priority from last year's NOFA was, and this was in the year before as well, so we can expect this priority to continue to be important to HUD, is strategic resource allocation using data and outcomes. So that's really kind of articulating what I've been talking about in terms of measuring performance. This means that communities should really be looking at their existing mix of programs and decide based on performance and what the community needs, whether it would be more effective if funds that are being spent on one kind of program should be reallocated to a different kind of program or project that would be more effective in reducing homelessness. And we can really only know that if we look at outcomes such as how many families have been housed through this program, what is the cost to house families, and things like that. So communities were asked to reallocate resources from low-performing projects to higher-performing projects last year, and we can expect that that will continue. And this really helps a community look at their resources strategically to make sure that they have that right mix of interventions that we know really works to end family homelessness. The second priority is ending chronic homelessness. This is an Opening Doors goal as well. And so one way that your community could show this is to show simply a reduction in numbers from year to year of your chronic homeless population, and to conduct activities to advance this goal, such as creating new units, either through new funding or reallocation, to specifically target chronically homeless people and families. The third goal is, again, from Opening Doors, which is to end family homelessness. The fourth goal is ending youth homelessness, ending veteran homelessness, which I know many CAP agencies have been involved in across the country in getting funds from Supportive Services for Veteran Families, a VA funding resource for rapid rehousing and prevention, to really work towards ending veteran homelessness, and using a housing first approach, which really means that all programs in the community, including emergency shelter and transitional housing, are prioritizing rapid placement into permanent housing for all people who are entering homelessness, and without any service participation requirements or preconditions. A lot of programs might have higher eligibility criteria, such as having to have a certain income or a certain time of sobriety. So this would be asking programs to lower those barriers and making sure that we are able to serve everybody who is homeless in our community. And HUD awards points to COCs that showed real results toward these goals. And if you're interested, if you're a CAP agent that's interested in applying for HUD funds, now is really the time to start thinking about what that might look like for you. You would probably want to think about what your capacity is, what type of program intervention you'd want to be thinking about applying for, and talking to your continuum of care leadership about what really what the community really needs. Next slide, please. And these are the resources that were available in last year's NOFA that will hopefully be available for new funding or reallocated funding for this year's NOFA. So if you are interested in applying, these might be available for application locally at your COC level. So rapid rehousing for singles, for families, and for youth, so rapid rehousing for every population. Permanent supportive housing that is specifically targeted to chronically homeless individuals and families, conducting a coordinated entry project, and administering HMIS, which is the Homeless Management Information System that Continuum of Care Program grantees have to use to enter data. So I'm going to hand it back over to Sharon on the role of community action agencies in this larger context, but I'm happy to take any more targeted questions. And we also have a lot of resources on our website regarding the HUD COC NOFA, which we expect HUD has said that it may come out in around the summertime, but we're never quite sure.
Okay, thank you, Cynthia. Can we go to the next slide? So again, we know that community action agencies are already doing a lot of work on the homeless interventions, and this is just some of the findings from the survey that we put out. Involved in CAP agencies are involved in eviction prevention. They're providing rent and security deposit to homeless people, but they may not be doing that in a coordinated way with rapid rehousing providers, and that would be a great opportunity for some collaboration. So in some communities, they are leading or supporting the community planning effort to address and end family homelessness. They may be running the continuum of care. They may be providing direct services. So it's our hope, I believe, Cynthia and I, that we will be learning from you, and that you who are doing some of this work can be helpful in communicating some of your lessons learned and strategies to your peers. So we really want to hear from folks. If you haven't filled out the survey, please do, and I'm sure that Tiffany can repost that at some point, asking for feedback for what this webinar series should be covering and what in particular and in what in great depth do you want to hear more about. Next slide. And just sort of a reminder that the Community Services Block Grant resources can be used as a match for McKinney-Vento Homeless Assistance Funds. Some of the very activities you are already doing today may be able to be used as a match, as long as the other requirements are also being met. So obviously this doesn't waive any of the other restrictions around CSBG. It must meet the purposes of CSBG and you know, everything else, but I think that the purposes of CSBG and McKinney-Vento overlap quite a bit, and the Office of Community Services is encouraging collaborative planning between organizations administering the CSBG grant and homeless service providers. So we're hoping that this will become a foundation for us to explore ways that we might be doing this already and ways that we can do more of it. Next slide. Just very quickly, things that are on the horizon. There's state and local policy opportunities to improve the lives of families experiencing or at risk of homelessness. The National Affordable Housing Trust Fund is going to receive, states will receive funding from that for the first time, and so there'll be state level activity to determine how those funds will be spent. And of course, we believe those funds should be spent to the greatest extent possible to people who are the poorest, who are at the greatest risk of homelessness, or people who are actually experiencing homelessness. There's a lot of policy advocacy efforts that are needed at the state and local level around how homeless assistance resources are used, so that they're used in the most strategic way possible to serve as many people as possible, so that, you know, we can get to a day where there is no family that's unsheltered. There are welfare policies that could be better. We have seen some states really take some steps and rethink how their TANF and welfare programs are serving families experiencing homelessness, and they become true partners in helping families escape homelessness and get connected to employment. And there's a lot of opportunities, I think, with making sure that families, again, as a reminder, half of the children are age 5 or under in our shelter system, and they could probably benefit from some Head Start programs and making sure that they're connected to child care and early childhood development. So ways that we can create greater liaisons between these service systems and making sure that homeless children are prioritized for some forms of assistance. Next slide. At the federal level, the Alliance is heavily involved in advocacy efforts. It's a big focus of what we do, and we need partners. And so if you're interested, we welcome you. And I'd ask that you just reach out to me. The federal budget includes increases to the McKinney-Vento Homeless Assistance Program. So this is what Cynthia's described. This is the major funding source for all communities to respond to the needs of all homeless people, people experiencing chronic homelessness, families, youth, children. There is an ask for 10,000 dedicated housing subsidies for homeless families, and that's a priority for us. And there are new investments in the federal budget for low-income children. Next slide. There's also some really fantastic initiatives we were very excited about in the federal budget that we're going to be working on. The President announced in his budget an $11 billion homeless assistance to families program that would be used to help 550,000 families escape homelessness, with some funding for housing subsidies and some funding for rapid rehousing assistance. This is, getting support. This would have to go through Congress, and Congress seems a little preoccupied with the election right now, so this would be a long-term project, but this is something that we would welcome our partners in the community action agencies to get involved with, to create new resources that will help families in crisis. There is also a proposal for is something else that has to go through Congress, an emergency aid and service connection initiative, and this was $5 billion over 5 years. And this is described as assistance that could, it's very similar to rapid rehousing, an infusion of resources, some financial assistance and case management assistance to help stabilize families who are in crisis or are on the cusp of a crisis, to help them stabilize and get connected to the supports that they need to avoid further spiral down into extreme poverty. And there's improvements in the TANF program. So we haven't really focused necessarily in this partnership around doing the policy advocacy work together, but I just wanted to lay those out and see if there were, if there was interest and request that you get in contact with us if there is. And finally, the last slide, and then we can go to questions, is again, if you haven't already done so, please fill out the survey that we put out, that the Community Action Partnership put out, saying that what you would like to learn more from through these webinars. We definitely want to be highlighting some of the promising practices that you're already engaged in and you're already implementing, so we want to feature community action agencies. This is this initial one. We wanted to give the broad overview, and we'll use your answers to shape upcoming webinars. So that's it, and so I think we have a good half hour for questions.
Sure, and just as a reminder to everyone that you can use the Q&A box, which is on your right side panel, to put in your questions. We do ask that you put to all panelists. That way we can ensure that your question does get answered. I do have a couple that are already in queue while you are typing those in. So first up, as you know, we'll be having a change in administration coming soon. If there's one thing that you could tell the new president about what is needed for families living in homelessness, what would it be?
I personally would say money. I think that when families are not extremely poor, there was a study years ago, one of the very first testing of rapid rehousing in Westchester County, and they essentially took homeless families who received welfare assistance and doubled their welfare check, and they resolved their own homeless issues on their own. They didn't necessarily, they're able to navigate if they have financial resources. And housing subsidies and temporary rent subsidies are a way of really helping people pay for what they need. Cynthia, what would you say?
I completely agree. I don't think I have anything else to add. I mean, mental assistance dollars, as we've seen, are very effective in really ending a family's homelessness, and I would say the exact same thing.
So, and if I could add, you know, the way that we're conceptualizing our response to homelessness, you know, families who exit homelessness are not just like fine. They you know, what we've done is we've ended their homeless episode. A lot of the families most of the families who escape homelessness, whether they have a housing subsidy, rapid rehousing, whether they've exited with transitional housing, are poor. And so they need what lots of poor families need. They need access to education and employment supports, quality child care for their children. They need work opportunities. Many have been, you know, while they may have comparable rates of domestic violence history, they have extraordinarily high rates of domestic violence history. So they may have trauma that they may want to deal with. That's definitely dealt better when they're in the home of their own and they feel safe. So we don't want to say all they need is money and they're fine. They need opportunities and they need pathways out of poverty, like all other families who are living in poverty. So we're very focused on ending that crisis situation and helping people get out of a crisis homelessness situation. We think is the first rung of that ladder.
Great, thanks. Next question up, you did have several issue areas that you mentioned, such as TANF or child care. What are some specific actions that community action agencies can do in the advocacy and education arena?
Well, actually, so this has been a bit of the 101, right? So this is the broad overview. And if folks were definitely interested in talking more about TANF or the child development, I'd like to communicate with them directly. There are a number of efforts within the homeless services world and actually at the national level to really improve the integration of homeless services with broader systems of care. You know, you know, making sure, and there's definitely some good policies that the administration has put out to make sure that homeless children have access or preferred access or facilitated access to Head Start and child care resources. So we could dive into some of those, but and in TANF as well, we nationally, less than half of the families who enter shelter do so with welfare receipt. You know, and there's just a new study that went out last week. In some states, and Georgia was one, you know, it was less than a quarter, less than 20% of families entering shelter have welfare benefits. So I think there's a number of different advocacy goals. It doesn't lend itself to a very quick and easy answer, but I think my first effort goal would be to make sure to be an advocate to make sure that homeless children and homeless families are getting access to the supports that they're entitled to. And something that's very helpful there is just data, you know, so being able to say 20% of our families, only 20% of our families have access to you know, are entering with welfare assistance. Can we improve that? Can we facilitate enrollment in welfare for these families? Can we perhaps potentially exempt them initially from work requirements? Can we, you know, so that's sort of the first rung. You could also talk about the fact that you have children in shelter throughout the day, and they would be better served in Head Start, where you're meeting their learning needs and they're being stimulated. This is an important, very young children, a very important time in their development, and we should be making full advantage of both this opportunity and recognition of how traumatic this episode of homelessness is for them. So the importance of buffering that child from exposure to the often chaotic places that they may be forced to stay while they're homeless, and while also helping them learn. It can provide such a stabilizing force in the lives of, I think, families to have access to additional supports.
Great, thank you. So I don't actually see any other questions in our lineup yet. So if people are still formulating them, go ahead and get those typed in. In the meantime, I wondered if either Sharon or Cynthia wanted to comment on the State of Homelessness in America 2016, which is brand new out.
Cynthia,
know about that?
Well, yeah. I mean, I think we
pulling it up.
Yeah, we see some. Yeah, it's a big project. I mean, I think that you know, we have seen reductions in homelessness, and you know, big picture. But it also takes a look at you know, where. Where those reductions are, where those reductions aren't, and what we did see, what we did see in some communities was increases in unsheltered populations, and I think that's important too, and that's something I think that internally we're going to be wrestling with. Cynthia, anything you would add?
Yeah, I think that what we're seeing is that the trends of the subpopulation decreases, especially in the areas that we've really targeted some of the funds the federal funds, such as towards chronically homeless people and veterans. You know, so the really targeted efforts and initiatives have been very strategic and kind of pervasive throughout the country. Really do see that these efforts are working, that these interventions are working. But then, as you know, I'd echo what Sharon said, is that one area that we're trying to get a better understanding on is the rise of unsheltered populations, and looking at things like shelter practices and how those can maybe be transitioned to be better engaging for people who are not sheltered, or try to get a better understanding of that. But we are seeing that generally, these interventions that have been emphasized and really been targeted well over the last 4 or 5, 6 years are really, we're able to see an impact, a positive impact in decreases.
Great, thanks. And just as a reminder to everyone, here on the slide, that is a link. And we will be putting both the recording of today's event as well as a link to the slides up on the partnership's website. So any of those stats from earlier in the presentation, this report, that will all be accessible from the slides. I would like to also reiterate the survey. I know we're starting to sound a little bit like a broken record on that, but it really will help shape what the rest of these sessions do look like. This is a learning community for you, so get your topics in so we know how to tailor this. We do have several other sessions already lined up as far as timing anyway, if not targeted to their topics yet. So do mark your calendars for June 15th, September 14th, and November 9th, all at 2 o'clock Eastern. And last but not least, this is not your last time to get in questions, so if you think of something later, please reach out to us here at the partnership. We do have the contact information for our Learning Communities Resource Center team up on the screen. You can reach out directly to Sharon and Cynthia. We did have their email addresses a couple of slides back. So don't make this the end of the conversation. And last but not least, do join us in Austin, Texas. We are going to be out there August 30th through September 2nd at the JW Marriott. We are planning on bringing out the Alliance, so these may be familiar voices that you'll get to hear out in Austin, as well as we are working on a focused kind of sub-track at our conference on SSVF, Supportive Services for Veteran Families. So I think there'll be a lot of great content for you guys to learn from in Austin, so do take a look at that registration. So with that, Sharon, Cynthia, any last minute tidbits that you'd like to leave them with before we close out?
Well, I just want to thank you all for hosting us, and also that I actually think that this is an exciting time to be involved in homeless assistance, but it's challenging because there's a lot of new practices and programs, and so I think having a learning community could be really beneficial, and we really appreciate the opportunity to join you on that.
And this is Cynthia. I want to echo again that we are very excited to be a part of this learning community, and we thank you again for asking us to speak today. And I know that there are many CAP agencies that play a capacity building role in their communities, building the capacity of agencies and all nonprofit agencies in many different ways. And I know that can range from case manager trainings to board trainings to helping with financial capacity building. And I'm the director of our Capacity Building Center here at the Alliance. We have a lot of capacity building resources on our website that may be helpful to agencies as they try to help their community. If they themselves aren't playing a role in directly providing services, they may be able to help programs direct their activities towards best practices and evidence-based ways of assisting homeless people in their community. So there's resources on our website. Please don't hesitate to reach out to us, and we'd be happy to have one-on-one conversations with anyone who really would like to explore that more.
Great. So I think that wraps it up for today anyway. Hope to see you at the additional sessions in this series and in Austin, and have a great rest of your afternoon. Thanks, everyone.
Thank you.
Thank you.